experience in managing piglet or goat mortality rates?
Now, that is a big challenge today. Many people, many farmers are losing animals. However, on the farms that I manage, we rarely have deaths like that. Reason being, we give detail. Like for example, I have a goat farm that I manage. I help the owner to manage its health. I myself, I must visit that farm, do a background search, a background study of this farm, look at its environment, look at whatever activity is taking place at this farm, look at the history of diseases that have been at this farm. I have a clear file of whatever is happening at this place. I give detail to whatever disease or whatever challenge health-wise that comes up at this farm. I make sure that I have a background of whatever has been happening at this farm health-wise. So that gives me a clear plan of how to go forward. A vet is not supposed to appear at your farm whenever there is a sick animal only. That you have a sick cow or you have a sick goat, now you need to call the vet. Sometimes we are not gods. We are not gods to make wonders at your place. We are not going to give you what you think we have come to give you. We can do what we are supposed to do, but at the end of the day, that is what we can do anyway. The other part is for God to do the wonders. You understand? So, you're supposed to have a professional guide you from the start. He's supposed to foresee the problems that may come to your farm as a result of this and that not being done well. You understand? He's supposed to look at different parameters of your farm and predict what is going to be the outcome after this and this a time. You understand? He's supposed to be at your farm to make sure animals need this kind of a vaccination. Let's do it at this and this a time. Like for example, the farms that I manage, we have a clear plan of vaccination. Every year, we list down the kind of vaccinations that a farm is supposed to have, depending on where it is located, the previous occurrences. We list down a number of vaccinations. We list down the deworming routines, because largely in so many farms here in this country and East Africa, it is internal parasites, internal and external parasites that are killing animals. Sometimes it is diseases, but the underlying condition that brought about that disease was the internal and external parasites. So we put emphasis on that, eliminating all internal and external parasites that are facing the animals at the farm. Now, other external parasites like the ticks, the lice, the mange, we also have a plan on how to eliminate them. So we work hand in hand with the farm staff. For example, a weekend where I have to conduct a vaccination, I go to the farm, or even if it is not a weekend, a schedule I have to be at the farm, I go to the farm, I conduct the vaccinations, but as I conduct the vaccinations, I'm looking at the animals. How are they? How is their body condition like? Do they have ticks? Do they have fleas? Do they have lice? Do they have mange? Do they have any signs of disease that I need to look at and find out which diseases are a little bit earlier before they put down the animal, I'll do that in my presence at the farm. You understand?
Yeah.
So after vaccination, I'm fully aware that this needs to be changed, this needs to be done, this needs to be improved. So we talk with my farm staff, and I make them understand that, and they execute or change what they have been doing. So in so doing, we can move a year, 2 years, 3 years without any deaths at the farm. But many people do not know these things. They do not search for knowledge. And with the people who give knowledge, there are so many players out there that are doing so many things out of non-understanding. So when you try to advise the people on what has to be done, sometimes they will as well try to silence you and beat you or put you down. So that is also another challenge that we are facing.
Before you talked of vaccination, a month or a year, a farmer has to vaccinate on his farm. How many times a month or a year?
There is not a drawn timetable that, or a drawn schedule that every farm has to vaccinate this. No, that does not happen. However, we look at the environment where this farm is. We look at the history of this district, or the sub-county, or the nearby areas. What have they been experiencing over time? Now we add that to the knowledge that, okay, the history that we've got from the farm. What disease have you been facing at the farm? So then from that, we can draw a schedule. For example, if you're in an area that has ever been attacked by foot and mouth, we can put foot and mouth disease onto the schedule of those diseases that have to be vaccinated. We can look at the herd and we know this herd is being challenged by clostridial diseases. We will put that onto the agenda. So we say, according to your farm and where it is and the previous exposure, let's vaccinate against this and this. And we give these vaccinations at least 3 weeks apart for you to vaccinate and get done through with these schedules. There is no planned schedule that this is what has to apply for all farmers throughout the country. No, that is not it. Vaccinate against clostridials, PPR, goat pox. Now there are areas recently that have been attacked by pasteurellosis. Areas like Kayunga, Mukono, those ends. So those ones can put pasteurellosis onto a list of diseases they can vaccinate against. There are areas that were attacked by anthrax sometime last year. You can put those areas onto a list to vaccinate against anthrax. There are areas that have not been attacked by foot and mouth. You do not say, since foot and mouth has been common in Chiruhura, let's go and vaccinate it. That's not how to do. Yeah.
Okay. What are your strategies for preventing and controlling common diseases in both livestock and pigs?
First of all, we have vaccinations. We've talked about that. These animal farms have different diseases that are important. And if they affect the animals, you cannot treat them. So you rather vaccinate them before they attack the animals. That is one. 2, good feeding is important in reducing disease occurrences. You know that these bodies can fight diseases by themselves if they are strong enough. So rather having different drugs and what, you find so many farms have drug stores at their farms to just treat. Rather than doing that to make investments in drugs and treating, I rather advise you to how to best feed the animals such that their bodies are strong to be able to self-fight against these diseases. Now, those are two strategies. The other strategy is through biosecurity measures. If you have a piggery farm, make sure that it is not being accessible to every Tom and Jerry. If you're getting into that kind of environment, be able to sanitize, be able to wash yourself. What do we call it? Be able to go through a bathtub that is put for you. These shoes that we move with from different areas, they carry so many different organisms that cause diseases. Be able to clean off before you get into this housing. Don't allow any animals to come into this housing. Birds, dogs, what and what. Don't allow all that. Don't buy feeds from all different places that you do not know about. You understand?
Yeah.
Now that is another factor. And lastly, hygiene is important. Don't keep animals in dirty places, because dirty places attract microorganisms that cause diseases. You understand? Yeah, that is it.
Dr. Derick, can you give us a word to our viewers who are watching our YouTube channel?
Animal farming is good business. Animal farming is business that you can do without so many external factors affecting you. However, to do animal farming, you need knowledge. Look for knowledge first. Even if you have the money, you can have so much money, but if you do not have the knowledge, you'll end up wasting that money. Look for knowledge before investing into this.